just what they need. Take the time to relax. Do something just for you. Self-care is an important gift. Try not to put too much pressure on yourself or others. Everyone is coping the best way they can. The best present for some may be simply having some time to relax and unwind. And I think I can certainly relate to that one. I also want you to remember that you are not alone this season, so please reach out for help if you need it. The Provincial Mental Health Crisis Line and the Channel Warm Line are here for you. You can also visit Bridge the Gap with 2 Ps and the Department of Health and Community Services website for more mental health resources to support you and your family. Whether you are celebrating the season or looking forward to the new year, remember we must all do our part to protect ourselves and others from the virus. Continue to adhere to our tried and true public health guidance. Keep your close, consistent contacts to 20 or less this holiday season. Maintain physical distancing. Wash your hands frequently and well. Wear a mask in indoor public spaces. And stay home if you are unwell. And call 811 if you have any symptoms of COVID-19. As a recap for those who may have just joined us, we have 5 new cases since yesterday's media advisory. The total number of cases in the province is 372. This holiday season will be different. As we begin to close the chapter on 2020, please continue to show each other love and kindness, protect and support one another, and hold fast Newfoundland and Labrador. Thank you.
Thank you very much, Dr. Fitzgerald, for your comments. It is day 286 of the pandemic, or if you'd like a new clock, it is day 3 of vaccine rollout in the province to essential workers and ultimately, very shortly after, to vulnerable populations. Before I start my comments today about COVID, I'd like to say a heartfelt thank you to Mr. Colborne and the choir at Holy Heart for a lovely Christmas carogram. They came to visit the department last year, and the video this year, because of COVID, was as beautiful as the visit from last year. So thank you very much. And on that note, I'd also like to thank Beachy Cove Elementary for their Christmas video as well, which I received today. Much appreciated. Thank you very much for the effort. As Dr. Fitzgerald says, it has been an exciting week with hope arriving in the province, somewhat ahead of schedule. We hadn't quite expected it this early, and so we're working out some of the rough spots on the plan, which we had initially thought we would be rolling out between Christmas and New Year, or even in the first weeks of January. I think from point of view of my comments, I would like to talk about some of the clusters that we've had. These have been groups of positive tests. And one of the things that has become apparent is that the first person in there who we identify as testing positive is not always the first person to acquire the virus, and indeed may actually be the last. From the point of view of what we call contact tracing, everyone knows that we look at people that a positive individual may have come into contact with after the results of after the start of symptoms. But we're also looking at now what's called backward contact tracing. And it would appear in a couple of the clusters, and particularly the one in Harbour Breton, which hopefully is drawing to a close, that backward step tracing show this is probably related to ultimately travel from outside of the province. I think that connection with travel there and the fact it predates the onset of symptoms, or indeed the sequence of positive tests, means that things like COVID Alert app, which will help you with an electronic form of memory, are something that would really come into its own here. The other issue around travel has been very much related to concerns people have expressed around some of our media advisories around travel. How is it that people from outside the province are coming to the province? I think whilst I can't speak to the specifics of any individual case, because that would be inappropriate, it's fair to say that non-residents could be coming here for a variety of reasons. Probably the commonest and most frequent that we've seen is that of family of a resident Newfoundlander and Labradorian who have moved away for work and now live in other provinces or indeed other countries. and under circumstances of family illness or bereavement, come back to the province and unfortunately have collected COVID at some point along the way. These are seen and listed in our data as non-residents, for example. We also have another group that are significant, more so not for their numbers necessarily, but for the impact that they have in the province. We have, for example, a piece of equipment at the Bliss Murphy Cancer Centre, which is crucial to ongoing cancer treatment, and yet it requires technical skills to keep going and to have routine maintenance that we don't have in the province at all. And indeed, I would argue, not in parts of the country. So you may, for example, see workers needing to come to service such equipment or specialized diagnostic equipment like our PET scanner or the cyclotron that goes with it. And again, if these people test positive, they show up as non-residents. And they would appear in our figures. And we can't give the details of those because, again, it's inappropriate. We have people here still relocating permanently to the province. It is an attractive place to come and live and work. And our immigration policy as government has shown an increase in numbers. And these people initially will appear under certain circumstances as non-residents. There are federal issues as well. People with the military who may do tech stops or come to collect vessels or meet vessels that would also be regarded as not Newfoundland and Labrador residents. So you can see the list is quite extensive and often quite particular. Obviously, people who have travelled, who ordinarily live in this province, have a right to come home, and they would show up as travel from other jurisdictions too. I think one of the comments that I would also make is that because of the time of the year and with people coming home to provide care or coming back from work away, we will continue to see greater numbers of cases perhaps than we have over the fall. This is to be expected. And I think the concern from our point of view is simply that everyone follows the rules about quarantine and listens to Dr. Fitzgerald's advice. But then in the situation that we have had to date, each of these clusters has been identified, rapidly isolated, rapidly contact traced, and brought to a halt. So we've made our own luck, and we've had some extremely good results from public health and from the effort of the people of this province in following things. But again, I would caution that we will see increased numbers, but that's no reason for complacency. We now have a schedule from Pfizer about some further vaccine deliveries that will take us through into the new year. And we're hearing that whilst not approved, Moderna is changing some of its restrictions about how it can be transported to make it easier to get into more rural or isolated communities. So there's more positive news on the horizon. It is the holiday season. Dr. Fitzgerald has asked us all to hold the line. We've done an exceptional job as a province, and you can see that when you compare us with other jurisdictions, even in Canada. It is the season of giving, and I think I would echo Dr. Fitzgerald's comments that maybe the gift of kindness is the one we can all give at really very little expense to everybody. And so with that, I'll draw this portion to a close and throw it open to Leslie to moderate the media interest. Thank you.
Thank you, Minister. For the benefit of our speakers, there are 4 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. I know yesterday the 3 cases announced were all under investigation. I'm wondering if there's an update on that.
Yes, Kellyanne, there will be an update, and I don't have them written down in front of me, so I don't want to speak out of turn, but they will be in the advisory that comes out a little bit later.
Great, thank you. And Minister Haggie, you alluded to that there's now a timeline or a better timeline on the arrival of the Pfizer vaccine. I'm wondering if the public can be privy to some of that information.
Yes, certainly. I mean, it's not secret. What we're expecting is another 2 trays early next week. There will be 4 trays, we think, between Christmas and New Year, and then we should be getting 4 trays on a regular weekly or 10-day schedule. So that will allow us to plan for rolling it out. At the moment, though, they have not relaxed their restriction that it has to be dispensed or used from the point of arrival. So once we get our ultra-low freezers across the province, then the vaccine will be taken there directly rather than necessarily coming into St. John's. So the next location that I'm aware of outside of St. John's, which gets an ultra-low freezer, and possibly within the next 10 days, will be Goose Bay, and then there will be at least 3 more in line, 1 for Lab West, 1 for Central, and 1 for Western.
Great. Just to clarify there as well, each tray, is that 975 doses?
Each tray is 1,950 doses. It's 900, the math is there's 5 doses per vial, and there's 1,950 doses in a tray.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi. I wanted to clarify, Minister, a moment ago you said that Moderna is changing its transport conditions. Was that did you misspeak? You meant Pfizer, did you?
No, I meant Moderna. They have already suggested that they will be comfortable transporting the vaccine for part of the latter end of the distribution chain, not frozen. So that is the difference from what we had expected before. So that will make it easier to move around into rural and isolated areas. From the federal table, I can tell you that the territories are going to get pretty well all of their vaccine in the form of Moderna, and I think this will make their life very much easier, and certainly will help us with Labrador and the coastal communities.
Okay, thank you. And the other thing I was curious about is as other vaccines come online next year, will recipients be informed which one they're getting? And I ask that because, for example, the non-mRNA ones seem to have a lower success rate.
Janice, do you want to deal with that?
Yes. So obviously anyone who's getting a vaccine will be advised of which vaccine they will be getting, and that is something that is standard practice.
Okay. And that will now be available electronically as well, so anyone with access to the Health DNL viewer will ultimately be able to determine that through that source too.
Okay.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Minister, you mentioned some hiccups in the rollout. I'm hearing from healthcare workers who have ended up spending hours and hours on hold to try and get their spot booked in order to get the COVID vaccinations, and then sometimes they get dumped off the phone lines completely. I'm just wondering why the process is sort of relying on a phone-based system rather than an electronic scheduling system like we saw with the flu vaccine.
2 reasons. One is the understanding I had was that the call center would be involved, but that doesn't start until the day we actually expected to get the Pfizer vaccine in the first place. So that was one of the hiccups of which I'm aware. The other piece is that if you remember, people are being triaged on the basis of NACI guidelines as to who will get their vaccine in what order. So given the fact that at the moment it's by Pfizer's insistence restricted to Eastern Health and pretty well a health science center, there needs to be a discussion as to what area of the healthcare system a particular caller would work in. So we're focusing initially on the COVID unit and on those public health and CDC nurses who would be in contact with people who may have active COVID, and then kind of work outwards there to, ICU, respiratory therapy, emerge, these kind of places. So there is a discussion that has to be had rather than just like with the flu where it's a self-scheduling self-scheduling approach.
We're seeing in the States that people are able to get, in rather than usual 5 doses out of a vial, pharmacists have been able to get 7 doses. Have we been able to stretch the doses similarly? What's the status here?
So we're aware of being able to get 6 doses out of a vial, and certainly, we're going to look at that, and that is something that we're investigating at the moment to see if that's possible.
Okay, thanks.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Dr. Dr. Haggie, in your opening comments, you mentioned backward contact tracing, specifically in terms of the Harbor-Breton cluster, and you said that would lead you to believe that ultimately those cases are travel-related. I just wanted to clarify, has a source been identified for that outbreak, and what exactly is involved in backward contact tracing?
Well, backward contact tracing essentially works on the premise that the person who you're talking to got the virus from somewhere, and it emphasizes trying to do that backward tracing earlier than later. And it's kind of been labeled by some as the cluster busting approach because it has yielded significant benefits if you can find a source that could be, for example, a super spreader. We certainly haven't seen that here since the spring or winter, to be honest. But my understanding is that thus far, every cluster that we have had in the province can ultimately be traced backwards in terms of a travel source who seems to be the source of the virus, even though that traveler may not have been the first person to test positive.
Thank you. And it was mentioned that we've begun, we're on to the 3rd day of vaccinations. I was just curious, how many healthcare workers have been vaccinated to date?
My understanding is they were doing around 160 yesterday and expect to do the same today. They will be vaccinating through the weekend, and obviously we'll have more accurate figures by Monday or Tuesday of next week. I think Wednesday was a day when really they just did their first kind of 3 vials worth, so there was only 15 that I was aware of on Wednesday, but I may be misspeaking there. I can certainly get you the detailed numbers.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, when we start to see our case numbers rise in terms of the daily numbers, mind you, it's still very low in comparison to other parts of the country, but 5 today, 3 yesterday, how concerned are you?
So at this point, our cases are travel-related, and people are isolating. It's fairly well contained. That we've had, occasional cases of spread to a close contact, but by and large, we're not seeing that spread outside of the household. And when we certainly have been able to be able to get a control of that and prevent further onward spread. So at this point, we expect to see cases. We expect to see travel-related cases. With regard to the epidemiology elsewhere, it only makes sense that we will start to see more travel-related cases. And I think this is this is a realistic expectation that everybody should have. And if we continue to do what we've been doing, if people continue to, isolate when they come here, if people hold fast to those tried and true measures that we've talked about, physical distancing, making sure you're wearing your mask, washing your hands well, staying home if you're sick, get tested if you're sick, we should be able to handle what comes our way.
Thank you. And it was noted the first day we began to roll the vaccine, so 2 days ago, that 28,000 people is essentially the goal by the end of the first quarter of 2021 to be vaccinated. If Moderna is to come online before that period, is that still the goal, or are we increasing that goal?
That goal would go up with every new vaccine that comes out. we, I think, are expecting somewhere of the order of 9,000 doses of Moderna, and that, again, is assuming the approval process proceeds for the first quarter of 2021.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Sorry, hi. I'd like to just follow up a little on Kellyanne's question. So do the new estimates of Pfizer doses, a certain number of trays every week or 10 days, does that change your outlook for March, the 28,000 by March?
No, so
No.
We've been allotted a certain amount of vaccine for the first quarter. So all of the vaccine that's coming is from that allotment of for the first quarter of 2021.
Okay, so that's not a new estimate. It's
No, these are all from our allotment.
Okay. For the information of your readers, Peter, the vaccine is bought nationally and distributed on the basis of population to territories and provinces.
Okay, thank you. I also wanted to ask about New Year's Eve. I think we are going ahead in St. John's with fireworks. Are you worried at all that when people are ringing out this Annus Horribilis that they might just let their guard down?
So, things can be done safely if people stay in their cars, in their vehicles. Certainly that can be, we can all enjoy the fireworks, but, we have to stay in line with those guidelines that we have, not mixing with people outside of your bubble, keeping your distance, and then hopefully everybody can enjoy.
Okay, thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, I've heard from people who are worried because they look on social media and they see people posting, hey, I managed to come for the holidays, even though they live in other parts of the country or even the world. Can you explain what exactly is the criteria on giving exemptions? If someone says, hey, I just haven't seen my family for a long time and I want to visit, is that the sort of thing you're approving?
I know. So there are criteria for exemptions to travel to the province, and they are outlined on our web page. But, we've had, from the beginning, we've allowed visits or people to travel here when there's been, critical illness or end of life illness in a family member, or if a family member requires care that can't be provided by anyone else. We've also allowed people to come in if they're relocating. We've allowed people to come in if they have significant illness and need to have care themselves. And we've allowed people to come in if they have employment here. So, there are a number of reasons why people would be allowed to enter the province. And so sometimes people say, I'm here and I'm visiting. The information that, is provided to the travel exemption team, visiting just for the purpose of visiting would not be considered a reason for exemption. So, what someone says on social media and what their true reason for coming is may not be the same. People may not want to give all that kind of personal information out, but so those are the exemptions that we would give here. There are a few others as well, but they're on our website.
Newfoundlanders and Labradorians have been watching the case numbers every day. I know a lot of people are also interested in the numbers of vaccinations as well. Will you be routinely putting out the number of people we've had vaccinated so at least there's a good number that we can watch go on?
I think...
I don't have a problem.
Yeah.
Sorry, Jen?
No, I was going to say we will be reporting on number of vaccinations as time goes on, and that is something that, the Public Health Agency of Canada is expecting us to report to them as well.
We do that for flu shots as well. I mean, we're up to, we will be up to 275,000, I think, by the end of next week.
And we report our, we let people know how our childhood vaccinations as well. So reporting vaccine rates is a standard practice.
Okay, thanks.
Our next questions are from Richard Duggan with BOCM. Please go ahead.
Dr. Haggie, just a few minutes ago, you mentioned some of the numbers of healthcare workers who have been vaccinated so far. Have we begun bringing in healthcare workers from outside the metro area for vaccinations yet? And if so, how's that working?
Not yet. We have not worked our way, as it were, through the COVID-related staff at Health Science Centre at St. Clair's. I think our main problem is really around Pfizer and Public Health Agency of Canada's restriction. As soon as we can put freezers in other areas, and as I said, I may have mentioned the sequence earlier on, we will then start to distribute vaccine to high priority groups in those areas. But true mobility really requires Pfizer to kind of let us off the leash a little bit in terms of how we move our vaccine from those depots. Challenge with Pfizer vaccine is you really need to focus on who you're going to give it to and how many you need to send and by what modality, because otherwise there's a significant potential for wastage. So we haven't been able to roll it out yet because of Pfizer and PHAC's restraints.
Thank you. And we've seen a number of cases over the last little while where the initial report would say that a case or the source of the case is under investigation and it hasn't been identified yet. And then the next day, we would find out that it's travel related and that person had arrived from outside the province. I'm curious because that information would come from initial conversations with that case. So, Dr. Fitzgerald, I'm wondering if you could explain sort of the process and why that information would not be immediately available.
So most of the times it's just because the time that we got notified of the case is so close to when the media briefing is, or when the media availability goes out, which goes out at a regular time every day. The public health team just hasn't had the opportunity to complete their initial investigation. That's all.
Thank you.
I will now go back through each reporter to see if you have one final question. Kellyanne Roberts with NTV, do you have a final question?
I do. Both for the Minister and Dr. Fitzgerald. What are you looking most forward to for this holiday break that I'm anticipating you'll get some of?
I'm just looking forward to curling up in front of the fire and not having to do anything for a couple of days.
Minister Haggie?
I don't think I'm really that different from Dr. Fitzgerald. It would be nice if the phone didn't ring.
Thank you.
Peter Jackson with the Telegram, do you have a final question? Peter, you might be on mute.
Sorry. Can you hear me now?
Yes, we can hear you.
Yes.
Sorry. This is a question that I could have asked right from the beginning, but I'm not sure why you use the 20-year age span for young adults. Like you say, 20 to 39, and then you go into 40, 50, 60. Why is that?
It's just kind of the standard age groups that we use. So that you'll see that in a lot of different things, not just in infectious diseases.
Okay. Thanks.
Peter Cowan with CBC, do you have a final question?
I do not. Just wishing everyone a happy holidays, since I'm going to be taking some time off, so this is the last briefing for me for a while.
Enjoy your time, Peter.
Yes.
Thanks.
Happy holidays.
Thanks, Peter. Enjoy. Richard Duggan with BOCM, do you have a final question?
Yes, I do. I guess Dr. Fitzgerald or Dr. Haggie, either of you could answer. We're like we've mentioned a bunch of times over the course of this briefing, we're nearing the end of what's been a wild year. We've been praised for our COVID response internationally. We've kept cases low. Overall, how would you characterize or describe the public's response over the last 9 months?
I think we've been You know, we've been very grateful in public health for the public's response to what has been a very challenging time. And, you know, we've said many times that we are where we are because the public has listened and because people have taken this seriously. So, you know, the vaccine on the horizon is, you know, makes everybody feel wonderful. It gives us reason to hope, but we do have to hold on for a little bit longer. And, you know, hopefully it won't be too long and we'll be on the other side of this.
Thank you.
Thank you, everyone. Minister, do you have any final comments for today?
I think, in actual fact, the best final comment came from Dr. Fitzgerald in answer to Richard's last question, quite frankly. We have done well. We need to continue to do well. And I think we can, at the end of this year, as we see out the old year and look to the new, give ourselves a bit of a pat on the back for provincially having worked really hard to stick together to do all the right things and do the right things right. So I think on that, Leslie, I'll close off and look forward to meeting with you all again on Monday.
Thank you, Minister. Take care, everyone. Stay safe and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering